$10 billion. I mean, just speak about the magnitude of that. That is by far the biggest commitment of the foundation, isn't it, Bill? I mean, this is by far the largest.
That's right. We've been spending a lot on vaccines. Even that commitment won't cover all the needs, so we need the governments, both in rich and poor countries, to come along. But millions of lives have been saved. With this commitment, over 8 million additional lives will be saved. So it's one of the most effective ways that health in the poorest countries can be dramatically improved.
I mean, the mission of your foundation has been clear. It's all lives have equal value. And this is really putting the stamp on that and saying everyone deserves to have disease prevention. Everyone deserves this. The people you deem those that have the fewest champions. Right now, in the midst of what has been the worst global economic downturn, how do you get the commitments that you need, the help that you need to leverage the billions you're investing?
I think we need to say to governments, this is something that works, that we know works. We wouldn't put our own money into something if we didn't put it down and realize that it's actually making a difference and saving lives. And I think we've seen it so much over the last decade, even with the Gavi Alliance. You know, there are 200 million children that otherwise wouldn't have been vaccinated or vaccinated. There are over 3 million children that are alive because of these vaccines. And the vaccines cost so little money to save a life in the developing world. And it's literally life-changing for that family to have those kids alive. So it's a great investment.
I mean, and you've seen it on the ground. You're just coming off of a trip to Malawi and Benin as well. Mm-hmm. What did you see that really invigorated you in this commitment to vaccines globally?
What invigorates me is to see a country like Malawi that is incredibly poor. It's one of the 10 poorest nations in Africa, making vaccines happen and work for them. So their country has committed some money. The Gavi Alliance has committed money to vaccines. And what I saw were these incredible health surveillance workers. They've trained 11,000 workers who go out into the rural villages where most of their population lives. They work with the mother and children so the mothers understand vaccination. They do some of it in the villages, 3 weeks out of the month. And 1 week out of the month, they're back in the hospital giving vaccinations. And so they're talking to the mothers constantly, not just about vaccines. The mothers are totally on board with the vaccines, but here's how you need to come from your rural area to now deliver your baby in the hospital so your baby can live in that first month of life. And it's just making an incredible difference. And to see a nation like that, who doesn't have very much money, but are actually getting their immunization rates up and really saving lives of these children under the age of 5, it's just incredible.
So you'd call Malawi a successful venture then, in a sense, at least thus far, correct? I mean, somewhere where you can see the results are tangible.
That's right. If you go back to 1990, 12 million children a year died. Last year that was down below 9 million. Now that's 9 million too many, but it's vaccines, it's malaria bed nets that have made that reduction. Now we need to take the vaccines that rich people take for granted, a couple of new ones, and get them out to the poor countries. And then we need to invent vaccines for some diseases that are only in the poor countries. Malaria is a great example of that.
What's the goal here? In terms of this new $10 billion commitment. What's the goal for this $10 billion commitment over the next decade?
The goal is to get the vaccination rate up even higher. And as Bill said, to get the new vaccines that are coming, technologies, there's a rotavirus vaccine. Kids die, 500 million kids die a year of a diarrheal disease called rotavirus. We don't really deal with it much in our countries, but we have this new vaccine. And so to get it out on the ground and get it out in a very quick amount of time to save those lives, or same thing, there's a great vaccine coming for a pneumonial disease that many kids in the developing world get. Making sure that these kids have access to the same technology we have in places like Europe and the United States, and they have it very quickly and that their lives are saved. That's the goal of this whole program.
How many lives do you think can be saved?
We feel conservatively that over 8 million additional lives will be saved during this decade. Mm-hmm. And the wonderful thing about that is that you improve health, you actually bring down the population growth. So any issue, whether it's the environment, education, jobs, food, are made possible as you get this improved health. And so vaccines really proven themselves, but we're going to need a lot of support in order for them to achieve their full potential.
What kind of support are you expecting to get from President Obama's administration and the U.S. government on this as we grapple with high unemployment in this country and many, many other issues facing the citizens of this country? There are those that will argue we need to help our nation immediately. How do you get the involvement that you're asking for from governments, particularly the U.S.?
Well, foreign aid is less than 1% of the U.S. budget, and this health piece is about a third of that. So as a percentage, it's quite small. And when people in our country hear the success story, when they know you're saving a child's life for a few $1,000s, I think even in a tough time, they want to make that allocation. President Obama made a commitment to double foreign aid. We're not on track to get that, but we're still hopeful that particularly with the help of these success stories, he'll be able to meet that commitment.
You've both written about in your annual letter that was just released about the reality that the Foundation's aggressive goals have been actually harder to achieve than you thought. What's the biggest challenge?
Well, I think there are many challenges, but I think that's one of the exciting things about the Foundation is that we can go out and take risks sometimes that a government won't take. So to go out and say, we set a goal a few years ago saying, let's eradicate malaria.
Well, wasn't that advice from Warren Buffett back in 2006?
Yes.
Don't play it safe?
Exactly. He said, don't just take, the soft, easy pitches. What you all can do is be catalytic in the things that you do. And we can take risks to try and create new vaccines where, there are going to be some candidates that fail or some candidates that point to where we ought to go next. But we're going to keep putting down our bets. And eventually we, with industry and then with the government, will get a malaria vaccine that then can be delivered. And for us, that's very exciting. So while our goals are ambitious, we still think they're the right ones. And we're here to work on this over the course of our lifetime, even if it takes us 10 years, 20 years to make progress on some of these very large-scale goals.
And the key to all of this is technology and innovation and leveraging them to the utmost. So you get, just to put it bluntly, the most bang for your buck. I mean, your business background plays into this hugely, right?
That's right. But technology has to be fitting the circumstances. And so when Melinda goes out in Africa, she comes back and reminds us, okay, there aren't trained personnel out there. There's not electricity out there. And so we have to start first with what can work and then make sure the innovators know, okay, what it has to be small, it has to be very inexpensive. And so technology, if we're not careful, will only solve the needs of the rich. We have to make sure that the needs of the poor are being heard and getting the best minds working on those problems.
Isn't there an example of that, a vaccine in Africa that will be distributed that you've worked on? You've gotten it down to 40 cents by going to the market and saying they cannot afford more than, say, 50 cents, so you have to market it right at them. Otherwise, it's useless, isn't it?
Yes, it has to be delivered in a way that countries can put up some money of their own, and they know it's a good investment, and then they know donor money is going to come in and help. But ultimately, it's going to be those nations, the African countries, who sustain that investment over time, and that's why it's a partnership together.
Yeah, the meningitis is a disease that isn't that widespread. It's in part of Africa, and that's where we found out that the nations would only pay very little. We used some technology from the U.S., but a manufacturer in India, and now this year, for the first time, that vaccine will be delivered to Africa. So it's kind of global cooperation to get something that's very inexpensive and can really stop these meningitis epidemics.
Bring us into your mindset, if you will. What goes through your mind when you decide where to put your money to work? What's the thought process?
Well, it is saying, okay, with the investments we can make, what are some of the lowest cost things that can help the poor really lift themselves up? So even in the area of some of the things of health that we've talked about, great vaccinations for children, there are other innovations. How, once you've saved a child's life and the family is trying to lift themselves up, there's some other great things you can do, like such as the area of savings. And some innovations that I was just seeing in Malawi were incredible on savings. So most poor people, they live in a rural area. They don't have the bus fare to come into town, much less do they feel comfortable going in a bank if they can't write their name. They don't have a driver's license or letter of reference to open a bank account. So what I'm seeing is some really innovative banking models going on where a small NGO will start. We might make an initial investment in them. They then become a commercial bank, and they're banking the poor in the rural areas by taking a smart technology. They literally read the thumb prints and the forefinger prints of the poor, and they put that on a smart card. So as soon as that person has that card, then any point of sale device that is around that the bank actually brings out to them through these mobile units, they can come in and put tiny amounts of savings in. And when you talk to women and men, it's transformative in their village to know that they can save $2 a day or $1 a day. So when it's time to pay the school fees, guess what? The money's there and it's in savings. But you've got to be really innovative because they can't do the traditional types of banking. But there's amazing innovation that we're seeing happening on the ground like that in Africa, bringing key technology to them.
And you have to be there to see it. What we've seen in the past few weeks in the wake of the crisis in Haiti is an outpouring of donations to what is the poorest nation in the Western Hemisphere. And it has just been crippled by what has happened. But how are we going to judge the results? Your foundation has put forward $1.5 million so far and is, of course, keeping an eye on Haiti. But how do we judge the results there?
Well, the goal in Haiti should not be to just get Haiti back to where it was before, because it was in an awful situation. Melinda and I have been down several times. And
have you been down since the quake?
No. But there's going to be a need for investment, not just in the next 6 months. It's going to take many years, whether it's the reforestation, the agricultural sector, the health. And so I hope we can sustain the attention there.
Do you think we can?
Well, it's often tough to do that. And one nice thing is a lot of these donations are done in a way that they don't have to be spent right away. They can go to these long-term needs. The outpouring is amazing. It's almost half of American families have made some kind of donation.
But you've got to rebuild it differently. I mean, we were in a classroom in Haiti, several years ago, and there's 60 children. Some classrooms I went into, there were 80 kids, and they're mixed grade levels, all the way from K through 8. That's not an education system. So as Bill says, as this gets rebuilt, it needs to get rebuilt in a new way. But that's possible.
Is it inevitable, though, that there will be waste in the system, a huge concern with government corruption in terms of aid in some of the poorest nations in the world? How do you prevent the waste? What have you seen being on the ground that will help in Haiti from preventing the waste for all the money that needs to be directed there?
Well, when I see governments come together, so a great example is Zambia. They said, we're going to tackle malaria, and we're going to deliver, it's very hard to do, countrywide, bed nets and do spraying in houses. They came together, civil society, the private sector, public sector came together and said, this is an operations problem. We've got to bring the nets in. The first year they kind of sat in the port, so there was some wastage there. They said, that can't happen again. What is it we need to do to move this all the way out to the village? You're always going to get a little bit of slippage, and you have to understand that. There's going to be somebody that gets their bed net and doesn't use it, or somebody that uses it for another purpose. But I think if you have these sectors in a country coming together and focusing and saying, what have we learned? What did we try? What worked? What didn't work? And then talking about that, then you can come up with new ways of doing things. And that's my hope for Haiti, is that the number of people who are in there and really trying to look at the problem in a different way and look at it with the people who are on the ground, the government in Haiti that still exists, and the people in Haiti, there's lots of ingenuity there. And I think it's that coming together with a common purpose. And believe me, there's a common purpose now to rebuild Haiti, and I think it can happen.
You think it can happen? You have called this a unique moment in history. Why is that, and why can't we afford to miss this moment?
Well, the world has these Millennium Development Goals, and it has very advanced science, and yet the difference between the richest and poorest is greater than ever. And we can increase the visibility, use the internet, we can get the success stories out there. Mm-hmm. We can teach people that the aid that they think of from decades ago that was motivated by Cold War alliances and was not very effective, that is not the way aid is being spent now. More and more goes to health and agriculture. That money is very, very impactful. So I think we do have the opportunity to sustain the momentum. The last decade was a great one. These new aid models were developed, groups like Global Fund, Gavi, both about 10 years old now, and they have some big, ambitious goals for this next decade. And so the increased visibility, the younger generation caring about these things, that's why we're optimistic and willing to put so much of our resources into these causes.
the recession, really the global crisis for the economies around the world has put a new face on what is enough. The compensation debate in the United States right now and elsewhere changes the picture of what's enough. Seeing all of the need, you've seen all of the misery and all of the hope. How has that changed your perception, both of you, of what's enough, really?
Well, I think you don't come back from, if you're in a slum in India or you're in a township in South Africa or the places that we go, these rural places in Africa, you can't come back not changed from it. And I think part of it is just anybody that I know that's traveled to these places or really seen it says, oh my gosh, maybe I don't need so much at home. When you see what it takes, how we live our lives and how these people live in their lives, you say, you just don't need so much. And what excites me is that I see these young next generation coming up. They're growing up with the world is open to them, right? Through technology, they're seeing it. They're getting it. They're telling the stories to one another and talking about it. And I think it's that storytelling and getting people to understand what's going on that people say, okay, I live in a global community. I need to share some of what I have with the rest of the world. And I think that conversation is happening in a completely different way than when I was in my 20s.
What do you think, Bill?
Well, I hope that we and others who've jumped into this can show how we're enjoying the work, how it has impact. Individuals can give a lot more. Corporations can take some of their innovators and their capacity and think more about the needs of the poor. As voters, we need to get our governments to do more. The historically low levels of aid should be changed. So there's many ways to get involved. Melinda mentioned getting out in the field. I'd love it if a higher percentage of kids or bankers using their bonuses would go out, go to Africa, and think about what really counts for them.
That's your advice to Wall Street. Go out there, take a look, huh? Thank you guys so much for your time and your effort. We appreciate it.
Thank you.